Hey there, viewers. Did you know that heart disease is one of the most common things killing men today? According to research, it affects 1 in every 3 men. Now, you might be thinking that a disease so serious would have some warning signs. However, people can develop heart disease without having a clue. They're just minding their business and bam, it happens. Heart attacks are that sneaky. In today's video, we'll talk about the potential signs and symptoms of a heart attack in men. Is chest pain a sign? What about sweating? What kind of pain in my upper body do I need to look out for? We're talking about all of this and more. Number 1. Upper body discomfort. Knowing the signs of a heart attack can save your life. Your ability to recover from one of these events depends on how quickly you receive treatment. Upper body pain is one of the most frequently neglected signs of a heart attack in men. Now, I will say this. Pain in your upper body can happen for a number of reasons. Maybe you lifted something a little too heavy and your muscles are paying the price. If you're feeling intense pain in several areas at once, this is when you need to worry, especially when the pain is constant. Pain or discomfort may spread beyond your chest to your shoulders, arms, back, neck, teeth, or jaw. Men can also experience upper body pain with no chest discomfort. A study showed that men have lower scores than women when it comes to their knowledge of cardiovascular disease. Poor understanding of the warning signs was significantly associated with age, gender, exercise schedule, and unhealthy lifestyle. Many people think that a heart attack is sudden and intense, just like in the movies, where a man clutches his chest and falls over. The truth is that many heart attacks start as a mild discomfort in the upper body. Many times, men who feel this kind of warning sign aren't sure what's happening. This discomfort may even come and go. Even if you're not sure it's a heart attack, you should still talk to a doctor. Have you ever dealt with upper body discomfort? Was it a warning sign for anything? Sound off in the comments section and start a conversation with our Bestie community. Number 2. Vital exhaustion. This term may be a little confusing. Of course, we've all felt exhausted. Some of us feel it all the time. Vital exhaustion is a little different. Vital exhaustion is a term used to describe a general feeling of sluggishness or lack of energy. You also feel highly irritable. It's not quite the same as being tired and lazy. Vital exhaustion is something that stems from numerous health problems. These range from not so serious to severe. Vital exhaustion comes from a man's unhealthy lifestyle. If you eat poorly, you're going to feel this way eventually. According to a recent study, men experiencing vital exhaustion are more likely to have a heart attack. If you don't like the proper steps to improve your health, a heart attack is coming. This is why you need to talk to a professional. They can assist with diagnosing your fatigue and then work with you to manage it. If this exhaustion comes with pain in your upper region, including your chest, back, and shoulders, get to a hospital. Things may turn ugly very soon. It's sad to know that each year approximately 200,000 deaths from heart disease and stroke are preventable. Regardless of whether patients show signs of heart disease or not, there are things that they can do to decrease the danger of having a heart attack in the future. It all depends on how you're living your life. Looking for the answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all of our great Bestie content. Number 3. Sweating. We've all had those moments where we start sweating uncontrollably, whether it's from a hot room or a heavy workout. Sweating is not just brought on by body temperature, it can also be triggered by our emotional state. The most common areas of sweating on our body include our armpits, face, palms, and soles. Sweating in normal amounts is an essential bodily process. If you don't sweat, your body will only get warmer. But you have to sweat in the right amount. There's dangers to both sweating too much and too little. Sweating can be your body's way of telling you that a heart attack is around the corner. If you're also feeling chest pain, dizziness, and shortness of breath, you should be concerned. Research shows that sweating during physical activity is healthy. Hot weather will also cause this. But when men begin to sweat while experiencing discomfort in their chest, arm, neck, or jaw, a heart attack may be on the horizon. Before we move ahead, here's another video you might like. If you'd like to change your diet, start with more veggies. Watch and learn what happens to your body when you eat broccoli every day. Now back to our discussion on heart attack signs in men. Number 4. Lightheadedness. Have you ever felt a little too dizzy? I mean, there's a strong chance you have. Dizziness is the third most common medical complaint seen by doctors in primary care. It affects more than 20% of the general population. Dizziness is the feeling that you might faint. You get all woozy, as if you can't control yourself. Your body may feel heavy and your head very light. Your vision may also become blurry. This usually comes with a loss of balance. While it's not always a cause for concern, dizziness can generally indicate an underlying medical condition and might increase your risk of falling down. This is why you should always be cautious when you feel lightheaded and keep track of how often you're feeling this way. Dizziness usually happens when you move quickly from a seated to a standing position. This change results in less blood flow to the brain. With your blood pressure out of balance, you're going to feel like you're about to faint. Research states that 4 out of 10 individuals have experienced dizziness severe enough to send them to a doctor. Also, lightheadedness along with other heart attack symptoms ought to be treated as soon as possible. These symptoms include facial drooping on one side, nausea, sweating, and vomiting, along with the usual chest pains. Remember, you shouldn't drive yourself to a hospital if you experience any of these symptoms. You could kill yourself and others. It's better to just call an ambulance. Number 5. Chest pain. Now, we've mentioned this a couple times now, but it's good to talk about it in detail. Chest pain is the most common symptom of a heart attack in men. Most often, it starts slowly with only mild discomfort. The sudden onset of severe symptoms is typically known as a Hollywood heart attack. This is because of the way heart attacks are shown in movies and television. A heart attack can happen this way, however, there's usually more to it. Men need to call an ambulance ASAP if their chest pain is sudden. If the chest pain is accompanied by any of the other signs we've talked about, there may be other reasons for the pain. Chest pain is a common complaint in all healthcare settings, with one of the more relevant causes being coronary heart disease. If someone you know experiences unexplained chest pain on the regular, book an appointment with a doctor as soon as possible. It's highly likely they have an unknown heart condition. Most heart attacks involve pain or discomfort within the center or left of the chest. Chest pain will sometimes last for a few minutes. It normally goes away and comes back when you least expect it. This is why it's good to get the proper amount of sleep. Remember that heart attack symptoms in men and women are usually different. 50% of men with heart disease don't even know they have it due to the lack of symptoms. It's tough to know if you're experiencing heart attack signs or something else entirely. Get immediate medical attention if you think you're experiencing any concerning symptoms. Men who have already had a heart attack should make sure that they take all the medications prescribed by their doctor. If the doctor placed cardiac stents to keep their heart vessels open or performed bypass surgery on their heart, taking the medications are important for preventing the attack from happening again. Schedule regular checkups even if you think you're in wonderful health. Establishing a baseline for your health can assist you and your doctor in addressing any complications that arise in the future. Let's keep the conversation going with a couple more heart attack related videos, shall we? Here's what you need to know. Check out 8 signs your body gives you a month before a heart attack. Or how about 10 foods that decrease your risk of a heart attack? Go ahead and click one, or better yet, watch both and learn how you can prevent yourself from having a heart attack. Have you or anyone you know experienced any heart attack signs? Let us know in the comments below.